Hey, good morning, everybody. Good to see you so early on this Sunday morning. Thanks so much for waking up with us. It's 5:30, and you are watching 13 News Dialogue, and we normally devote the entire 30 minutes of this program to great community organizations and programs that you may want to check out and get involved with. We're going to change things up a little bit right now for this episode to talk about your health, something very important our first guest wants to talk to you about, and here he is. He's Dr. Donald Liebell. He's a chronic pain specialist. And I know as we get older, we deal with a lot of chronic pain. Most of us do. Nice to have you here, Doctor.
Thank you very much. Pleasure.
You wanted to come on and talk to us about hypertension and your neck. Are they connected? And what brought this up?
Well, this is something that is actually, it's not new news. However, it's something that is probably unfamiliar to most people.
Okay.
Discoveries that are often made a long, long time ago don't come to light for quite a period of time. And the connection between the neck and high blood pressure is an interesting one. Recently, a study was taking place, published in the Journal of Human Hypertension through the University of Chicago, and it was actually reported by Dr. Timothy Johnson on Good Morning America recently about how correction to a tiny misalignment in the upper neck, right at the base of the skull, could lower blood pressure.
You brought some models to demonstrate.
Yes.
For us. Why don't you hold those up and show us exactly what you're talking about. All right, now explain to us what is this?
This is a plastic model of the neck.
Okay.
This part over here is the base of your skull, so right at the back of the head.
All right.
And the most important area is right over here. This is the very first bone of your neck. It's called the atlas, very appropriately named after the Greek mythological figure who held the world up on his shoulders.
Okay.
The atlas vertebra weighs about 2 ounces, and the average human head weighs about 16 pounds or so. So it's basically the weight of a bowling ball.
Wow.
Held up by something the equivalent to the weight of a Dixie cup.
Wow.
And if we look in here, we see this is the area where the brain ends and the body begins, essentially. We see the spinal cord and nerves that come out, and also arteries along the side. And what we look at in my specialty, which we call an upper cervical specialist. Cervical is just a fancy medical term meaning the neck.
Okay.
So upper cervical, top of the neck. The atlas vertebra is the upper cervical spine. If this doesn't hold your head up level, so if literally your head is not on straight over your neck, many, many things can take place here, one of which is compression of the nerves of the spinal cord, brainstem area, and as you can see also in red,
if
are
that
arteries.
happens, would we feel that?
Well, you can, but in many, many cases you can't. Because what can happen here, we're not talking about a giant twist. We're talking about a very, very subtle thing, a matter of even a fraction of a degree or a millimeter of shift, which can result in an interference to many, many processes of the body. In fact, most people, as far as my patients and my colleagues around the world, treat people with various chronic pain conditions. And so the idea of treating people with high blood pressure is something that's pretty new, even though it's been known for a while. High blood pressure has so many different causes, many of which are not known, and typically treated through medication. In this university study, what they did was, using the type of procedures that I do, is mathematically determine how the skull and the neck are sitting relative to one another. If this little bone here has the tiniest shift, that actually can cause high blood pressure. And so in this study, the tiny misalignments between the skull and the neck were determined, and corrections were made, and there are procedures which are done, some of which done generally by hand or with a specialized instrument, which in my practice I use a sound vibration instrument to realign that. And it is that realignment in the study that created drops in blood pressure that were absolutely astonishing. As the medical director of it, Dr. Bakiris, said was the equivalent of 2 hypertension drugs.
Wow. And
they're conducting larger studies now.
So how would you even think to check this in some patients? I mean, obviously, if the blood pressure levels are elevated, that may lead you to perhaps go down this path. But the normal patient, I mean, how would you even go here?
Well, it's a very good question because, again, there are so many different causes of hypertension.
Yeah.
People find doctors like me because of chronic conditions, chronic pain conditions. For example, probably more than any other condition people come to see me for is something that's called fibromyalgia, which is a fairly mysterious chronic pain condition that affects the entire body. And so we find this misalignment, this dysfunction of the upper neck and those people with migraine headaches, people with just generalized neck pain, chronic problems like that. So what we often find in case history is that people with chronic problems of the pain variety that have this imbalance over here, this misalignment, we'll find in their history they often have high blood pressure.
What about
also
stiffness of the neck?
Oh, absolutely. Yeah, I mean that's probably the most common criteria. Just a person who, when they turn their head, can't turn it fully. In fact, a lot of people don't realize how restricted the motion of their head is. They may turn to the right fully and then just turn about that much to the left, but it's happened, or seemingly it's happened so gradually that they don't even perceive it as being abnormal.
Well, if people have more questions, unfortunately our time is up, they can head to your website, correct?
Correct. Yes, in fact, on my website, which is necksecret.com, anybody is welcome to, on any of the pages, email me a question. There's a forum on there, and I usually get back to people within 24 hours time.
The doctor is on call. You can also call 631-9799. That's 631-9799 if you have any questions for Dr. Liebell. Thank you very much, sir.
My
Appreciate
pleasure.
it.
Thank you.
Interesting segment there. Back with more 13 News Dialogue for you right after this.